If you are over 60, there is a simple movement that can reveal more about your leg strength than walking around the house. You need only a sturdy chair and 30 seconds. The test is used in the CDC's Fall Prevention Program to assess leg strength and endurance. And the number of times you can safely stand may help identify declining strength before it begins interfering with your independence. But please don't start yet. First, I'll show you how to perform the test correctly, who should not try it alone, and exactly how to compare your result with the reference score for your age. Then I'll give you 3 simple exercises that may help improve the movement. Before attempting the test, please put safety first. Do not try it alone if you have fallen recently, feel unsteady while standing, experience dizziness when getting up, have severe knee, hip, or back pain, use a walker or another mobility aid, have been advised to limit physical activity, are recovering from an operation, injury, stroke, or serious illness. Ask a family member, caregiver, physical therapist, or healthcare professional to stand close enough to assist you. If you experience chest pain, severe shortness of breath, sudden weakness, faintness, or sharp pain, stop immediately and seek appropriate medical care. This is an educational screening activity, not a diagnosis and not a competition. If you appreciate practical, evidence-informed health information for adults over 60, subscribe to Senior Health. We explain important health topics clearly without making impossible promises. Think about how many times you stand from a chair during an ordinary day. You stand to answer the door, prepare a meal, use the bathroom, get out of a car, and leave the dining table. Every repetition requires your thighs, hips, calves, core, and balance system to work together. Some people can still walk reasonably well, but begin pushing down on the armrests every time they stand. Others rock forward several times before they can get up. These small changes are easy to dismiss as normal aging, but they may indicate that standing has become harder than it used to be. The 30-second chair stand test gives us a structured way to observe that change. According to the CDC, its purpose is to assess leg strength and endurance. A below-average score can be a sign that someone deserves a more complete fall risk assessment. However, the test cannot tell you why your score is low. A low result could involve reduced physical activity, muscle weakness, joint pain, balance problems, medication effects, or an underlying health condition. That is why the number must always be interpreted in context. Here is what you need. Use a straight back chair without wheels. The standardized CDC assessment uses a chair approximately 17 inches high and without armrests. Place it firmly against a wall so it cannot slide backward. Make sure the floor is dry, level, and free of rugs or clutter. Wear supportive, non-slip shoes. Have another adult stand beside you for safety, especially if you have any uncertainty about your balance. Sit in the middle of the chair. Place both feet flat on the floor, approximately hip-width apart. Keep your back straight. Cross your arms over your chest, placing each hand near the opposite shoulder. This arm position matters because the assessment is designed to measure how effectively your legs perform the movement without your arms pushing you upward. If you cannot stand without using your arms, do not force it. That is useful information to discuss with a healthcare professional or physical therapist. Here are the rules. When the timer begins, stand all the way up until your hips and knees are straight. Then sit back down with control. That counts as 1 repetition. Continue standing and sitting for 30 seconds. Move at a steady pace, but do not bounce, rush, or drop heavily into the chair. Count only complete stands. If the timer reaches 0 while you are more than halfway to a full standing position, the CDC instructions allow that final repetition to be counted. Are you ready? Remember, only participate if you feel safe and have someone nearby when needed. Otherwise, simply watch the demonstration. Demonstrator performs controlled repetitions. Keep your feet flat. Stand tall. Sit down gently. Breathe normally. You are halfway there. Do not rush. 5 seconds remaining. And stop. Sit comfortably and allow your breathing to settle. What does your number mean? Now let's compare your number with the CDC's below average reference scores. These figures differ by age and sex. For men ages 60 to 64, fewer than 14 stands is considered below average. For women in that age group, it is fewer than 12. For ages 65 to 69, the number is fewer than 12 for men and fewer than 11 for women. For ages 70 to 74, it is fewer than 12 for men and fewer than 10 for women. For ages 75 to 79, it is fewer than 11 for men and fewer than 10 for women. For ages 80 to 84, it is fewer than 10 for men and fewer than 9 for women. For ages 85 to 89, fewer than 8 is below average for both men and women. And for ages 90 to 94, it is fewer than 7 for men and fewer than 4 for women. These are reference points, not grades. Completing one fewer repetition does not mean you are about to fall. And completing more than the reference score does not guarantee that your balance is perfect. Chair height, technique, pain, fatigue, footwear, and even how active you were earlier that day can influence your result. Look at your score as one useful piece of information. If you completed the test safely, tell us your age group and number of repetitions in the comments. You may encourage another older adult to start paying attention to their leg strength. But please do not compare yourself competitively with someone who has different health conditions or abilities. 4 results you should not ignore. The number is important, but how you moved can be just as revealing. Here are 4 observations worth discussing with a professional. Number 1. You could not stand without pushing with your hands. That does not mean you failed. It means your current leg strength, technique, pain, or confidence may need attention. Number 2. You repeatedly lost your balance or fell backward into the chair. Poor control during the downward movement is important because sitting safely requires strength as well. Number 3. One leg did most of the work. Consistently shifting strongly to one side may happen because of pain, weakness, or a previous injury. A physical therapist can assess the movement more carefully. Number 4. You experienced new pain, dizziness, unusual breathlessness, or sudden weakness. Do not continue repeating the test to see whether the symptom disappears. Stop and speak with an appropriate healthcare professional. Seek urgent medical help for sudden one-sided weakness, facial drooping, difficulty speaking, chest pressure, fainting, or severe breathing difficulty. Why walking may not be enough. Many older adults tell me, but I walk every day. Shouldn't my legs already be strong? Walking is valuable, but walking and strength training are not identical. Your body adapts to the demands placed on it. A comfortable walk may improve endurance without giving your muscles enough resistance to maintain all the strength needed for standing, climbing stairs, or recovering your balance. Current activity guidance for older adults includes aerobic exercise, muscle strengthening activities, and balance work, not walking alone. Share this video with a parent, spouse, or friend who has recently started using their hands to get out of a chair. That small change may be worth noticing early. 3 exercises that may help. Here are 3 beginner-friendly movements related to the chair stand action. Your appropriate exercise level depends on your health and mobility. If you have significant weakness, pain, balance problems, or a chronic medical condition, ask a qualified professional to modify these exercises for you. Exercise 1. Assisted sit to stand. Sit toward the front half of a sturdy chair. Place your feet slightly behind your knees. Lean forward from your hips while keeping your chest lifted. Push through your feet and stand. If necessary, use the armrests or place your hands on your thighs for assistance. This is an exercise, not the standardized test, so using support is acceptable. Sit down slowly. Try not to collapse into the chair. Begin with 5 comfortable repetitions. As the movement becomes easier, gradually work toward 8 to 12 controlled repetitions. You can also reduce the amount of help you use, but only when it is safe. Exercise 2. Supported heel raises. Stand behind a sturdy chair or at a kitchen counter. Hold the support with both hands. Keep your knees relaxed and slowly lift your heels, rising onto the balls of your feet. Pause briefly, then lower your heels with control. Begin with 8 repetitions and gradually work toward 12. Your calf muscles help support walking, standing, and ankle stability. Do not perform this movement without support if your balance is uncertain. Exercise 3. Seated knee extensions. Sit tall with both feet on the floor. Slowly straighten one knee until the leg is extended comfortably in front of you. Do not force the knee completely straight if that causes pain. Pause briefly, lower the foot, and repeat with the other leg. Perform 8 controlled repetitions on each side. This movement targets the muscles on the front of the thigh, which contribute significantly to standing from a chair. For all 3 exercises, move slowly and breathe normally. Sharp pain is a signal to stop, not something to push through. Older adults are generally advised to include muscle strengthening activity on at least 2 days each week, along with aerobic and balance activities. Start at a level that matches your abilities. How to track improvement. Do not repeat the full 30-second assessment every day. Daily results can change because of fatigue, soreness, sleep, and other temporary factors. Instead, concentrate on consistent, appropriate activity. Consider repeating the assessment after several weeks, preferably under the same conditions. Use the same chair. Wear similar shoes. Test at approximately the same time of day. Use the same technique. And have the same safety support available. Improvement does not always mean adding many repetitions. Standing with less assistance, using better control, feeling more confident, or moving more evenly between both legs can also be meaningful progress. If your ability is declining rather than improving, or daily activities are becoming noticeably harder, arrange an evaluation instead of simply exercising harder. Your final score is not a prediction of exactly what will happen to your health. It is a snapshot of one important ability: standing repeatedly from a chair using your legs. If your result was below the reference point, don't panic and don't ignore it. Discuss it with your doctor or physical therapist, especially if you have fallen, feel unstable, experience pain, or have noticed a recent change. Strength can often be worked on, but the safest plan is one matched to your body and medical history. If this video helped you, press the like button and subscribe to Senior Health. In the next video, we'll look at 3 common reasons older adults can lose leg strength even when they are still walking every day. Until then, stay active, stay careful, and remember, protecting your independence begins by noticing small changes early. Watch next: why your legs get weaker even if you walk every day. Disclaimer: educational information only, not medical diagnosis or individualized treatment.